No, you're not supposed to smell like a rose or a flower or a rose garden or things like that. The society that we live in would have us thinking that we're supposed to smell like a flower or floral or fruity or whatever. But no, that's not what our vagina is supposed to smell like. I'm going to tell you what your vagina is supposed to smell like, what it likely smells like. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. If you like this content, please subscribe to my channel. Facebook, please like my page and follow along. Okay, so yeah, back to the flower. No, we're not supposed to smell like flowers or roses, and good thing, because we don't. Let me tell you, I can tell you this from years of looking at vaginas through doing pap smears in the office as a family doctor. Every woman has a unique scent. We have our own unique sort of smell. Sometimes it's slightly musky, sometimes it's a little different. Again, every woman is different, and it is normal to have a slight sort of scent to you. Yeah, that's normal. It's part of who you are. It's what makes you unique. So having a slight scent that is normal for you is quite normal. Don't let anyone or any society tell you that that's not, okay? Also, just a little note about vaginal discharge, although this video is not focusing on vaginal discharge, it is normal to have sort of a clear to white sort of vaginal discharge, okay? That also is relatively normal as well. I'll have another video on vaginal discharge, but focusing on odor. So I know you're probably saying, well, then wait a minute. Well, I mean, how do I know if my odor is right or normal or not? And that's a great question, okay? So here are some signs that you may need to sort of think twice about your vaginal odor. First of all, if you're experiencing an odor that is just different from your normal, you know what you smell like. It's a scent that you're actually familiar with, whether you realize it or not. Start paying closer attention when you go to the bathroom, when you shower, at the end of the day, things like that. You will notice a pattern in how you smell, and you'll come to get used to it. If you notice a change in this scent, well, that may be cause for, hey, let me check with my doctor to see if there's something going on. Other things, a strong odor that is not, normal for you, a strong odor should prompt you to seek medical care. A fishy odor, okay? A discharge that is different from your normal, that is different from sort of that clear white discharge, a different discharge, a clumpy discharge, a gray discharge, etc., accompanied with an odor or even separate by itself, that should prompt you to see your doctor. Also, if you have any other symptoms such as itching or burning or discomfort around your vaginal area, the vulva, etc., the skin is different, okay? All of those changes should prompt you to see your doctor, all right? But this is the thing, our vaginal odor may also change quite naturally. So I mentioned that we all have a scent that is unique to us, that is our own. But that scent, and you probably notice this, by the way, write in the comments if you feel so inclined, write in the comments if you have noticed that your own natural scent tends to change depending on what's going on with you. So things that can cause a change in your vaginal odor would be things like your menstrual cycle. That is a big one for many women. Oftentimes you may even be able to tell where you are in your cycle based on the odor or the scent that you have. Also, things like exercise or activity can change your scent. Sexual intercourse or sexual activity can change your scent as well. Also, the pH level of your vagina, if that's changed for any particular reason, that certainly can change the scent or odor. Even foods or things that you ingest or eat can change sort of your scent, your vaginal scent, okay? So those are things that can actually change it. But so when it comes to our vagina and what it should smell like, hopefully you're getting the sense and the point, one of the main points of this video, which is that your vagina has a natural odor and it's perfectly fine, a natural scent that is uniquely yours. Now, if you experience some of the changes I mentioned, you have a strong odor, you have a vaginal discharge accompanying with it, you've got skin changes, etc., the odor is different, etc., there are some things I don't want you to do, okay? And I don't want you to do this actually no matter what, whether you think you have these changes in odor or if it's your normal scent. I don't want you to douche, okay? Douching is not helpful. In fact, it can actually cause some problems when it comes to vaginal odor and other aspects of your overall vaginal health. Douching does not help. Also, I don't want you to stick anything up there that doesn't belong there. What am I talking about? I'm talking about things like yoni pearls. I'm talking about other substances, whether it's garlic or other things you might have read may help your vaginal scent. I don't want you to do that, okay? Yoni steaming, I don't recommend it. Other things, feminine washes and feminine sprays are not recommended. Once again, these products can actually cause sometimes more problems than you could even imagine, okay? You don't need them, and again, they can be potentially harmful. Those are things I don't want you to do. If you feel like your scent or your odor is different than normal, the first thing you need to do is you need to see your doctor to get a proper diagnosis. Number one, to see if there is an underlying cause for that change in your normal scent. Is there an infection? Is there something else going on? A skin condition? Something else, okay? And that's why if you have a change in your natural scent, the first thing you should do is not try to figure out what it is or to fix it. Okay, you should go to your doctor to try to get a proper diagnosis. That is the first thing, all right? And then, of course, the other things is don't do the things I just mentioned, whether you think you have an abnormal odor or not. But let's talk about things you should do, okay? Things that can help promote you having sort of that normal, healthy vaginal odor that is uniquely yours and that is okay and healthy and what we call physiologic. Things you should do, wear cotton undies. That tends to be very helpful in general, okay? Cotton as opposed to other fabrics. Also, loose-fitting clothing can be very helpful for down there, okay? Kind of allow us to air out, and that tends to be a good thing. Also, some other things that can be very helpful, looser clothes in general, and not just looser undies or sort of undies that are not too constrictive, but looser clothing. Sometimes we may wear like stretch pants or things like that that can be really, really tight, really kind of constricting. Looser clothing can sometimes be more helpful. Something I think is really, really interesting is the use of panty liners when it comes to periods and stuff like that. There are many sources, and I believe this, that say that panty liners actually can trap moisture down there and may not be helpful when it comes to odor, bacteria, and things like that. So it's not that it's wrong to use panty liners when it comes to your period. It's just that you may want to use them judicially and be very thoughtful about how you use them, especially if you do have concerns about your vaginal scent. Also, we want to make sure that we're bathing properly. Use a gentle wash. You don't need to scrub and scrub and scrub down there. We don't want you scrubbing anything, okay? Also, don't use harsh soaps that can be really irritative. Don't want you to do that either, but just sort of a gentle cleanser and just making sure that you're maintaining proper hygiene. And then also something that I think goes without saying is that if you're working out, you've been active, things like that, just don't stay in damp, wet undies, okay? If your undergarments are wet, soiled, things like that, you want to make sure you swap them out, you change, you make sure you clean up, and you get some nice fresh undergarments on just to kind of help make sure that you got some airflow, you're removing potential sources of bacteria, wicking moisture, all of that good stuff, okay? But the bottom line here is just a couple of take-home points I really want to hone in on. Number one, having just sort of a natural scent that you smell that is yours is normal, okay? It can have a slightly musky odor, that's okay. It's going to be different from woman to woman. Any change in that odor really should prompt you not to self-diagnose, but to see your doctor, because you want to find out if there's a particular reason for that change in odor that needs to be fixed, any infections or things like that. So your doctor is your friend. We can certainly help you with a lot of this stuff. And then keep in mind some of the things I talked about, not douching and putting things up your vagina that shouldn't go up there, making sure you're wearing cotton sort of loose undies and things like that. But guys, remember, guys, or rather ladies, sometimes people say in my videos, oh, I hate how you use the word guys. I think it might be a Midwest thing. I'm from the Midwest, and we often say guys, you guys. So I don't mean anything by it, but this is the thing. Remember, you are uniquely you, and don't let anyone tell you or any society tell you that having a scent is not okay. We are not flowers. We were never meant to be flowers. Your vagina is not one either. I hope this is helpful. Let me know in the comments. Please share this video with anyone else you think might benefit from it. Let me know your thoughts, okay? Write them down. Let me know what your experience has been. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of stuff. Please subscribe to my channel. Click the little bell for updates on Facebook. Please like my page. I also have channels on WhatsApp, Instagram, TikTok, etc. at Dr. Jen Caudle. Make sure you follow me. Also, go to my website, www.drjencaudle.com, to sign up for my free health newsletter. Guys, I'm Dr. Jen. I'll see you soon.